Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. I'm continuing on with my series of When the Body Tries to Warn You. I'm coming up on part 4, so as I always do, please make sure that you watch parts 1, 2, 3 so that you can see how I got to part 4 here. Now, I had a little problem with my last video. TikTok's algorithm or whatever was having a problem with some of the words that I used, which is difficult when dealing with health issues. There are certain words that are more appropriate, but to the algorithm, they're naughty words. So I need to be a little more aware of myself when I'm recording this one so I don't have that problem again. But anyway, I want to get on with part 4. And this, of course, is the moment of truth, the big surgery. So I had been placed onto a gurney to go down to the operating room. My upper torso was at a slight incline, just enough to see where I was going. I had nothing else than a hospital gown on and a warm blanket covering me. Through swinging door after swinging door, we got onto an elevator, then got off the elevator, and through some more swinging doors, finally arriving at the destination, the operating room. Now, the operating room wasn't that large. There was an anteroom off to my left where I believe the participants involved would wash up before entering this arena. Then things got uncomfortable and quickly because I was hoisted onto the operating table, stripped of my blanket, and then stripped of my gown, laying completely naked in all my glory, and it was definitely cold. And that is not a Seinfeld punchline. If you've seen it, you know what I'm talking about. Just then, two assistants began positioning me and securing me with my arms spread like a crucifix position. And now my nerves were working overtime. This was really happening. But I couldn't get any words out. I wanted to change my mind. Soon, both of my arms were secured, and I could not understand why, especially since I would be out cold for the surgery. I began to scan the room for answers, and all I saw were more tools, more supplies, including a coiled up roll of plastic tubing. I don't know what that was for. Well, I eventually found out. Just then, I heard a soft voice off to my right. My God, he's so young. As if on cue, I was finally able to speak, and I blurted out, I am young, and I have two daughters that are counting on me to get through this. Please don't let me unalive. I could see everybody's expressions, their genuine concerns and care. And then a voice came through speakers in the ceiling. Off to my right was some sort of control room, and there at the microphone was my surgeon. This is Dr. P, and I'm calling a timeout. The timeout is what a doctor does to verify that they have the right patient and what the patient was going to have done. Now, I understand why I had not been sedated further because I needed to acknowledge to the doctor who I was and what he was going to do to me. As soon as I answered, I went to sleep. And I'm only aware of what happened and was done by reading the surgical report. Really cool, really nerdy, really detailed. Perhaps a separate video, but not here. I was to have a vein or artery harvested from my left leg, and a triple bypass was to be completed. There had been no time to explain to me how this was all going to be done or what to expect afterwards. On one hand, I consider myself fortunate that I didn't have to stew and sweat waiting for this to happen, as I've seen plenty of patients having to wait weeks, even months, having to worry and stress about this surgery. I definitely take the no notice approach. So my eyes began to open slowly, and my body felt like it had been hit by a Mack truck. I couldn't move my head, my arms, nothing. I wasn't able to talk or call out for help. Soon my eyes began to adjust, and my eyes would flutter left and right, trying to make sense of where I was, what happened to me, and why I couldn't move or talk. Of course, this panic elevated my heart rate, which brought in my nurse. She could see that I was struggling and that I was confused. As I looked around the room, I saw so many machines and heard so many bells and small motors for these machines. I could see that I could also see that I was alone. I mean, I was alone and I couldn't understand why. My nurse's name was Jackie, and she was very young, and what an important position she had in her career. Jackie was soft spoken and soothing, but at the moment she could only do so much. She said, "Hi, Paul, my name is Jackie. I want to tell you that you're fine. Everything went the way it was supposed to, and you're now recovering in the ICU. I am your nurse. I need you to relax. I'm going to explain some things to you, but I need you to try and remain calm. Your surgery went great. You still have a tube down your throat, which is why you can't talk. It is there to help you breathe. It will come out soon enough. Your arms and your hands are secured to keep you from accidentally pulling out or tugging at all the wires in the tubing. Again, this is temporary. I need you to do a couple of things if you can using your fingers, okay? Answering one finger for yes, two fingers for no. So I positioned one finger, and as she acknowledged that and said that she would get me something for the pain. I continued to scope the room and could not see anyone waiting for me still. And at this point, my heart rate began to escalate, prompting Jackie to ask me to focus on calming down while she gave me something to help do that, as well as help with the pain. And I was out cold once again. Now, I'm not sure how long that little nap lasted, but when I woke up, there was Jackie taking care of the many bags of fluids that I had that were hanging by my side. She looked and saw my eyes were open and again asked how I was feeling at that moment. And again, I remembered that I had to communicate with her using my fingers. So I remained calm. I was still struggling with the pain. I was given heavy duty stuff, as lesser meds would not touch the pain. But pain management is key at this point. Okay? Pain equals stress. And the last thing that I needed was stress. Jackie felt it was time to explain some more details to me and that I would be able to handle it. Of course, she explained all of the wires to me, the telemetry monitoring my heart. I had 3 drainage tubes coming out of my abdomen, my chest, and I had what was called a PICC line coming out of my neck. Boy, am I glad I was out when they put that one in. This line did several things, such as delivering medications, drawing blood, and it also provided the ability to monitor my blood pressure through my heart. Okay, and then of course I had the breathing tube for the respirator helping me breathing. Jackie got done explaining everything and told me that soon things would start getting removed as my vitals and symptoms improved. I would probably stay in the ICU yet another day. There were no windows, so I didn't even have a concept of how long I'd been in the ICU. But just then, someone was coming into the room. From the shadowy figure in the doorway, I could tell it was another female. She got closer. I could see it was a familiar face. It was Heather, my nurse from the cath lab just the day before. Heather had heard about my surgery and was coming to check on me and how I was doing. This would not be the only time that she did that. Jackie took the opportunity, having the extra set of hands in the room, to reposition me, and then Heather went back to work and Jackie went back to monitoring. The chair in the corner of my room remained empty. Of course, anyone who has stayed in the hospital knows what it's like spending time in the hospital, constantly getting disrupted hour after hour for blood and other tasks. My first interruption was a doozy. A chest x-ray needed to be done, and I was still intubated. An army of people came into the room, 2 people on each side, raised the upper part of my bed, and then securing me at the same time, and once at the proper vertical position, leaned me forward just a smidge, but enough to hurt like hell. They got their x-ray and then lowered me back down. Jackie gave me something for the increased pain I was in, and then back to sleep I went. That's going to do it for this part. This actual section actually has to be done in a second part itself. So until next time, this is Paul's Heart.